Good morning, everyone. Thank you to Dr. Oliver, Dr. Krishnan, and the Mount Sinai Heart leadership team for my opportunity to speak today. My name is Catherine Kinslow, and I am currently a clinical nurse on the post-interventional step-down unit at the Mount Sinai Hospital, and I'm here today to speak to you on the nursing care and discharge education of post-peripheral interventions. I have no relevant financial relationships. So when a post-peripheral intervention patient is admitted for overnight observation, the nursing care is essential to monitor for possible complications of the procedure and provide comprehensive education to the patient and families. Proper nursing care post-procedure allows for a swift response to changes in the patient condition, which leads to a decreased rate of complication and length of stay. Comprehensive nursing care allows for a rapport and trust to be built between the patient and the nurse. The trust can translate to individualized education of the patient and family to increase autonomy of care, patient satisfaction, and prevent readmissions. The nurse assessment after peripheral intervention is essential to monitor for changes in patient status. It is important upon admission for the nurse to review with the patient and family what can be expected during their overnight stay and the goal of discharging before noon the next day. First, it is necessary for the procedural nurse and floor nurse to do a focus assessment together at bedside handoff. The nurses will assess the access site and ensure it is free from any bleeding or hematoma. From there, the nurse will assess the distal extremities for warmth, capillary refill, sensation, and pulses. The floor nurse will utilize this baseline assessment throughout the hospital stay for further assessments. A baseline neurological assessment is important, especially post-sedation, to assess if the patient is at baseline orientation status and able to follow commands. The focused baseline assessment is essential to the nurse to be able to recognize changes in patient condition and act promptly. Vital signs are cycled frequently post-procedure. The nurse will monitor for hypo and hypertension. Hypotension could indicate the patient may be bleeding or it's a response to the sedation the patient received, while hypertension could lead to bleeding at the access site. The nurse also monitors for changes in cardiac rhythm and will escalate outliers as appropriate. The nurse is responsible for ensuring the patient maintains bed rest and educates the patient on why they have to remain in bed. This is a new experience for most patients, and therefore ongoing education is key. Explanation of the risk of bleeding and setting expectations or a timeline for bed rest in a way the patient understands can lead to better bed rest compliance and decreased risk of complications. Once bed rest is over, the nurse will assess orthostatic blood pressure and ambulate the patient as appropriate. IV fluids are infused for 8 to 12 hours post-procedure. Patient education on the need for IV fluids to reduce the risk of contrast-induced nephropathy is important. Strict intake and output is assessed with emphasis on urine output 8 hours post-procedure. Lastly, patients with end-stage renal disease on hemodialysis will not receive IV fluids, but instead the patient can anticipate hemodialysis prior to discharge. From the moment the patient arrives on the floor, the medical team is planning and preparing their discharge. The nurse has a very large role in patient education for a safe and efficient discharge. At admission, it is explained to the patient they will have repeat labs drawn in the morning as well as an EKG. If the lab work, EKG, vital signs, access site, and pulses are within baseline, the attending will grant clearance for discharge. The nurse will prepare a discharge folder with printed information on new medications and peripheral intervention discharge instructions, such as access site care and smoking cessation. All the printed information is provided in the patient's preferred language. Now we're going to have a quick review of the content of the nursing discharge education. As will be discussed in a few moments, discharge education is not a one-size-fits-all. It is individualized to the specific patient. Here are some of the most common education points. First, we review with the patient what to do in case there's bleeding. We explain to them how to hold pressure on the site, as well as ask them to demonstrate so that we can ensure they're doing it properly. Next, we go over bathing with the patient. We ask them to just use soap and water on the site and avoid any lotions or powders in the area to prevent any signs of infection. Next, we review with the patient what signs of infection actually may be and what to do if they believe they have an infection, which would be to call their doctor. Activity is also reviewed with the patient and family, and this one usually has the most questions. We ask that the patients don't do anything strenuous for the next 2 weeks and avoid lifting, pulling, or pushing anything heavier than 10 pounds. This is usually where patients ask specific questions about their day-to-day life, as if they can do stairs, if they can resume exercise. So this is where the individualized education really comes into play. We also go over what to do if they have pain with them, and we remind the patient that they can expect some pain or discomfort as blood flow is returning to the leg, and then just use Tylenol as needed for pain. Medications are also reviewed with patients, and again, that's a specific patient list that we review with them depending on their discharge medications. Discharge education also includes teaching a heart-healthy diet. This teaching emphasizes the importance of low-fat and low-sodium adherence. The nurse will review with the patient the difference between healthy and unhealthy fats, as well as provide on where to find information to continue heart-healthy meal planning. One of the most important pieces of discharge education the nurse reviews with the patient is what to do if there is an emergency outside of the hospital. First, the nurse has the patient teach back signs and symptoms of a heart attack and stroke, as well as what to do if they experience these symptoms. When to call 911 is reviewed, as well as ensuring the patient can find the phone number to their physician and discharge unit in their discharge packet. The patient will also have a follow-up appointment with their attending scheduled by the time they are discharged. Again, the nurse will have the patient repeat back when the follow-up visit is and what to do if they need to make a change to the appointment, as well as where to find the doctor's phone number and the hospital unit-specific phone number. As you have heard, there's a lot of information taught to patients between admission and discharge. The registered nurse will assess the most appropriate learning method of the patient and their co-learners. Recognition of patients' and families' learning preferences will make the nurse's education more impactful and meaningful. Providing education and all medical information in the patient's preferred language is a patient right. Some patients may do well listening to the nurse explain the discharge instructions, while others may prefer to read handouts. Using either method and in any language is essential for the registered nurse to ensure teach back. And what does teach back look like? It's simply the patient being able to demonstrate understanding of the material. Teach back can be through question and answer, discussion, and any other means that demonstrate patient understanding. On the unit that I currently work on, we do have some repeat customers, and recently I took care of a patient and his wife earlier in the year, post-peripheral intervention. I spent a lot of time with them quizzing back and forth regarding the groin instructions. By the time we got to discharge, both were well-versed in the care of the access site and what to do in case of complication. Last week, the patient actually came back with his wife, and they both still remembered the instructions and were able to teach them back to me. So in conclusion, nursing care and close monitoring are essential to the success of the patient. Education is important to empower patient and families, and nurses play an essential role in bridging the expertise of the endovascular team to the success of the patient. Thank you.